Morning, 9 on your side's Veronica Acosta tells us what behavioral experts say they're doing to help and what you can do as well.
For many, it's been a year of isolation. As the holidays get closer and closer and the number of COVID-19 cases rise in Arizona, those most vulnerable are subjected to even more isolation.
There's been a significant increase in incidents of anxiety and depression. That's community-wide, and it's actually nationwide.
John Reardon is the Chief of Clinical Behavioral Health with MHC Healthcare. He says during these times, he's really pushing the availability of telehealth services. Tom McKinney, the CEO of Interfaith Community Services, says they've set up a calling system to help those who might need someone to talk to.
We're still doing friendly calling with people. We have volunteers that will call and make sure folks are all right, or maybe spend some time with them on the phone.
Over at El Rio Health, behavioral health services staff are providing as many resources as possible.
What I do with patients that I interact with who aren't doing so well is just to wrap around as many services as I possibly can.
Datola says they too are reaching out to people they've listed as vulnerable via phone.
We just do a combination of both outreach, both over the phone or through telehealth.
He says in times like these, when vulnerable family members may have to spend more time alone, his biggest piece of advice is to continue connecting.
I strongly recommend people to pivot and move over to things like we're doing right now.
Through services like Zoom or FaceTime, making sure everyone has someone to talk to during the holidays. Veronica Acosta, KGUN 9 on your side.